We are visiting with Dr. Siby today with CIS, the Cardiovascular Institute of the South, over in Opelousas. That's where he is working. And today we are talking about advanced heart failure. Now, what is advanced heart failure, Dr. Siby?
Advanced heart failure is basically when the heart doesn't really pump well. It can't eject enough blood out of the body. When that happens, then the body doesn't have enough oxygen to perform daily tasks. And so advanced heart failure is when, after your doctor kind of sees you and tries some of the initial therapies, or if he feels like it's beyond his expertise, then they can refer him to me, where there's a lot of advanced options that we use, such as defibrillation therapies and advanced heart failure techniques of left ventricular assist device, heart transplant, starting to look at those kind of really advanced options.
Now, why is advanced heart failure more prevalent today?
It's because we actually, as cardiologists, we do a lot of good work. Now, almost any cath lab you go to, people can survive from their heart attacks. I'm sure many people have many grandparents who suddenly died and they don't know why, and they assumed it was a heart attack, and most of the time it was. But nowadays, when people have signs and symptoms, they come to a hospital. The hospital is very keen to find a heart attack, and if it's happening, we stop that from happening. But the damage a lot of times is already done, and that damage the people have to live with, and that's the majority of the heart failure that we deal with today.
Now, tell us some of the symptoms we need to be on the lookout for.
In general, for heart failure, we have to look out for swelling of the legs, shortness of breath with minimal activity, small things such as taking out the trash, or vacuuming your house, or even taking a shower. Some people, they have a hard time when they're going to church. These kind of things kind of make people a little bit more short of breath. They have sometimes chest pain for a minute. Sometimes they feel their heart racing. These are kind of the symptoms that we look for.
Thank you so much for joining us today, Dr. Siby.
Okay.
And make sure you guys are looking out for these symptoms and contacting your physician if you are noticing any changes. And if you would like to schedule an appointment with Dr. Siby, you can visit cardio.com. Again, he is with the Cardiovascular Institute of the South in Opelousas.